Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Now here's your host, Matt Fisher.
Welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today are Dr. Paul Casey, Chief Medical Officer for Rush University System for Health, Ben Wolfe, Director of Digital Transformation at Rush University System for Health, and Sonia Singh, Chief Insights Officer at AVIA. So it's going to be a jam-packed show. So all of you, welcome to the show.
Thanks, Matt. Thanks for having us. Appreciate it.
Yeah, so before I get into the main part of the conversation, what I find is always great is to give everyone a chance to give a little bit of an introduction in terms of who they are and what they do. So I'll just go in order of kind of how I introduced you. So Dr. Casey, I'll give you the floor first.
Thanks, Matt. Appreciate it. So Paul Casey, I'm the System Chief Medical Officer at Rush University System for Health, which is a 3-system hospital in Chicago and kind of extending into the western suburbs with a number of other ambulatory sites, surgery centers, et cetera, as well. I've been at Rush now 14 years. More recently, over the past few years, been helping to lead our digital transformation with our excellent team that we have on here. And that's really in service of our CEO's vision to be one of the most digitally transformed organizations in the country.
So that seems like a great transition to turn it over to Ben.
I'm really happy to be here. My name is Ben Wolfe. I'm the Director of Digital Transformation at Rush, working closely with Dr. Casey and really the whole Rush leadership team. Been in healthcare for about 17 years, a variety of different roles. Almost all of them in some form or fashion has been sort of change management, technology, innovation, strategy leadership, et cetera. And at Rush, I lead the digital transformation team that's really the kind of the keepers of the flame for that innovation vision that Dr. Casey just alluded to. So we're, helping our leadership team craft the vision, the strategy, and then oversee the execution of that strategy long term.
Hey, great. Thank you. Sonia.
Yes, Sonia Singh. I'm the Chief Insights Officer for AVIA, which means I lead our market intelligence, our research, our thought leadership on the possibilities of how digital can transform the health systems from an operations standpoint, from a consumer experience standpoint, from a care transformation standpoint. And that looks at not just technologies, which are important, which will be a part of that digital transformation, but also what is the vision, the strategy, the business model, the ROI, the metrics, all of that is really important as health systems think about digital in their broader journey.
So all of you were definitely talking about digital transformation, which is clearly kind of a hot topic and area of interest for systems across the country. So Sonia, I'll turn it to you first and just kind of get your perspective on, from a macro perspective, how do you go about beginning to think about engaging in digital transformation, and what are kind of some of the trends broadly across the industry that you're seeing?
Yeah, I'll start with what you should not do from a learning standpoint. I will say that digital transformation is not about just improving the website or just picking one tool or doing more of just the EHR. Right? It is actually thinking about what is the broader business vision, and that could take different forms. It could be, for some organizations like Rush, you started with what's the big radical consumer experience vision that digital could enable. For some organizations, is how can we transform care and how care is distributed and delivered in radically new ways, and what's the digital aspect to that. For some organizations, it's how do we create a really agile operational structure that allows our organization, our health system, to react and respond to the market as it moves? And what is the digital underpinning for that? So it starts with the vision and the business strategy. And then following that, there's a lot of pieces that are really important. What are the core components or the core capabilities you're looking for? What is the team that's going to drive it? What's the governance structure you need? Where is the funding and the allocation of those dollars going to come from? How will they be used? What are the metrics that need to be decided upon? Because unless those things are done, many digital projects fail until all of those things are lined up. So that's really how we take organizations through that process.
So Dr. Casey and Ben, hearing all of those challenges and kind of all those, kind of components to not just thinking about and planning for, but starting to implement. How did your organization approach actually starting a digital transformation process? And I think it's really interesting that that you're bridging both the clinical and the non-clinical perspectives, because I feel like when I've talked to other folks, that's where breakdowns can occur, where you don't have those two sides working with each other.
Yeah, and maybe I'll start with that one, Matt. I think honestly, this is really work we couldn't have accomplished without our partnership with AVIA. And I think we found ourselves a couple of years ago seeing this transformation, this kind of tide, beginning to take off. But we also realized there's really the temptation. All of us get 100 emails from different solutions looking for a problem every single day. And we really wanted to be intentional about, not pursuing a number of point solutions, but instead, as Sonia described, take a step back and really look at the entire strategy on how we can transform the way that we deliver care, from an accessibility, care delivery, quality perspective, and then really plot that roadmap from there for the next 5 years and how we're going to look at it. And I think, without the help of AVIA and Sonia's expertise as well, we might have limited ourselves a little more to changing the things we do today to a digital platform, as opposed to thinking much more broadly about consumer experience and how it should look and feel to really try to get healthcare to be as convenient as what you experience in any other industry, like the restaurant industry and Open Table and Amazon, et cetera. So with that, Ben, I'll turn it to you.
Yeah, no, I think that's spot on. And, with Avia's help and within the Rush leadership team, I think, we've really challenged ourselves, to Dr. Casey's point, to take inspiration from others out of industry, retail, hospitality, travel, but also from some of the disruptors that are in the market. You look at what Amazon's doing and their focus on convenience and ultra simplicity and how you access care. So our mantra has been, let's dream big here. Let's start with the end in mind, that we want to be as convenient, as always on, as hyper accessible as some of these disruptors are, as some of these other service industries are, but then pair that with something that we think we really have an advantage in, which is a nationally leading clinical care model, clinical excellence, the research and subspecialty care that an academic medical center can provide. So I think that's where we sort of see our into the market here is learning from others that have done this in other ways in other industries, but then bringing our special skill sets and our organizational capabilities to bear on top of that.
And Matt, if I could just add one point quickly, I think also it's important. This can't be a side hustle, as we say. This can't be something that's done on the side. So I'd say most importantly, you need someone that's a great partner that wakes up every day thinking about how we can do this better. It's got to be a full-time, really a team's job to approach this. And I think we're fortunate to have Ben's leadership on our team, but we're also fortunate to have great partners in digital and IS that are willing to think a little bit differently about how we deliver care.
No, you all raised a great point about kind of learning lessons and kind of being able to carry over experiences from other industries. Obviously that's kind of a touch point across the industry as well. We're talking about consumerism and, the patient experience, which, I think all of you are recognizing raise a lot of very great points. But at the same time, I would be interested to know, how do you adapt those kind of lessons from other industries to healthcare? Because, I think whether people want to admit it or not, healthcare is different than, say, walking into a Target or going shopping on Amazon.
I think just to give you an example, this morning, someone had recommended a book to me, and I got on Amazon and I have the book. It's sitting on my desk. So I think when you think about healthcare, most people want that same degree of radical convenience, right? They don't want to have to drive to go see their physician and park in a cumbersome parking garage and find an office. They want the ability to, when they need it, be able to pull it up and connect with their physician or connect with the right subspecialist. And the example, kind of analogous to Amazon, is there's no reason we shouldn't be able to have a prescription, if needed, at that patient's door, within a few hours. There's no need to intersect with pharmacy delivery systems and things like that. So that's just one example, but I think really that's where we continue to push ourselves is, how can we deliver that same level of radical convenience regardless of what part of the health system you're interacting with?
Yeah, and maybe just to add to that too, I think to state the obvious, and this kind of gets back to an earlier point that was made, is as we're designing these things and taking inspiration from the Hiltons and the Deltas and the Netflixes and the Amazons, all of that's happening side by side with our clinical partners, where we're envisioning the future, but then applying the pragmatic healthcare lens of how is this actually going to work? How do we make sure that anything we do digitally or virtually is as high quality as you would expect in person? How do we make sure that anything that starts digital can be handed off or transitioned into the physical in-person care that you may need when you need to get an X-ray, or you may need to come in to get a strep test or whatever the case might be. So it is, Matt, to what you alluded to, it is a risk that if you approach this from a purely technology perspective, or a pure sort of Silicon Valley, let's dream big ideas sort of thing, that you can easily go down the wrong path given all the fraught areas of healthcare. So I think, we're really trying to sort of be the applied sciences of digital innovation here. Let's take inspiration from these other industries, but then apply the sort of the healthcare model to make sure that it works in the real world and that we continue to deliver the excellent care that our providers are known for.
Yeah, what I will add is, because I work with so many organizations at different level of appetite towards this, it's so much easier to say, we are different, we are unique, we are special. It's not going to work. But what I like about folks at Rush and other leaders who are thinking about it is like, okay, yes, it's different, but let's see of the areas where it could work and then align it with what's possible and take that very intentional approach that Ben and Paul just outlined. I think that's the starting point, and that can yield huge benefits versus taking the easier path, which is just saying we are special, it won't work, because then healthcare will never change.
And actually, kind of, Sonia, building off of that point, and I suspect you might have a particular insight kind of given how Dr. Casey described the relationship, but I imagine these statements of, oh, we're unique or, we're special also come from the vendor side, as Dr. Casey alluded to, of, you're constantly hearing pitches of who can come in and help. So how do you go about sorting out, who to work with that aligns with the vision that's being established as part of the transformation process?
That's such an important question, because it's very easy, and I've been in the space long enough that that shiny object syndrome exists in many places, where it just seems so cool when you see that first demo, you just want to go out and buy it. And I think instead of that, you have to take that very strategic, thoughtful approach of the right fit and the right timing and the right setting in your overall strategic process too, because sometimes you can buy the right solution too early in the process when the organization's not ready, and then it becomes the wrong solution. So you also the organization needs to be ready. All that pre-work needs to be done of having the right governance structure, the funding aligned, making sure it fits into the strategy, making sure it fits into the overall technology roadmap and vision, because again, the right solution can be the wrong solution at the wrong time. So all of those things need to line up for it to really be the right solution. And I think the other thing I would say is there's no one size fits all. There's no silver bullet. So I think you have to be also very open on both sides of the table to work with each other, to tweak and customize and find the right partnership. So it isn't just like, here's my solution and I'm never going to change it. And the health system also can't be too rigid that they also don't work with it. So I do think it's coming together in that true partnership standpoint of finding the right fit, finding the right partnership. And by the way, the team matters a lot too. I see that a lot with many vendors of having the right team that brings the right partnership mindset of like, let's do this together. Let's solve a problem together versus I'm just selling you tech. That makes a huge difference in how successful a vendor can be.
And I would just add to that, I think it's another big value that we've had in our partnership with AVIA is, for health systems, it can sometimes feel like there's 1,000 different vendors and solutions out there for a given, once you actually have your problem statement and you start looking for vendors. So it's really great to be able to turn to someone with industry expertise, not, based on what relationships they have, but say, here's the top 2 or 3 that, fit health systems with your same profile. We've really found that to be valuable as we assess these partnerships.
Yeah, no, I think you all raised great points. And for those of you just joining, I'm talking about Dr. Paul Casey and Ben Wolfe, both from Rush University System for Health, and Sonia Singh from AVIA, talking a lot about digital transformation. And I'd like to pivot a little bit because all 3 of you have brought up the importance of governance throughout the discussion. So the first thing I want to do is have all of you actually define what you mean by governance, because I suspect that's a very complicated and multi-layered concept. So Ben, I'll turn over to you first.
Yeah, sure. And you're right. I think this is one of the not so flashy secret sauces to this success in this space. And for me, governance is one of those things that I think a lot of people, when you envision governance, you sort of think of dusty reams of paper with org charts and process flows. And it's not that, right? Or at least it shouldn't be that if you're going to do this the right way. So I think as we set off on our digital journey at Rush, the way we've thought about governance is first, it's who are the few key leaders that are really going to be the energy behind this and really help to build excitement, awareness, literacy, in some cases, digital literacy within the leadership team and within the organization, and really sort of push the organization. So it really does start with bought in senior leadership. And at Rush, we've been lucky with Dr. Omar Latif, our CEO. He's really helped to convene the leadership team around this vision of radical reinvention of our care. So that's the first point is commitment of leadership. And then once you've got that, the rest gets a lot easier, to be honest with you. I think from that point on, it's about assembling the small, nimble group of leaders that can help craft the vision, that can help put the right people in the right roles with the right accountabilities to execute on that vision, and making sure that this is a whole health system approach. I mean, I think I can't stress enough the importance of a multidisciplinary set of leaders around this problem. It can't be a technology problem. It can't be just a clinical problem. It's got to be an all-in team that's focusing on this. So at Rush, what we've done is put together a small and nimble group of 8 to 10 leaders over these key areas that can really move quickly, that have decision-making capability to move things ahead, and that can empower their teams to make this a priority in their own days. And so I think that's has been a major success for us. The other part, and I won't go too deep on this, we could spend an hour just on the mechanics, but I think the other part of governance that's been so important for us has been what happens down at the kind of boots on the ground level, and having the machinery, the process, the agile approaches for how you work in a really iterative, really data-driven sort of way, so that you get things out into the market quickly. You have a process for collecting patient feedback and provider feedback, and then iterating over time. And so that's as we talk about governance, it's sort of about direction and steering, but it's also about how does that direction get translated into execution. And we put a lot of work into making sure that those trains run on time.
I love everything what Ben said and completely agree. The thing that I'll add as food for thought is you often hear the adage that culture eats strategy for breakfast. And I think governance is a little bit of that missing link to address that gap, because the right governance structure aligns the vocabulary, how we talk about things, how we incent people, how we communicate, so that you don't take a great strategy and then it gets more and more and more diluted by the time it hits the ground. I think the right governance structures, avoid that situation happening as well. And it all comes down to exactly, Ben described it beautifully. All of those pieces need to be put in place for that.
So Dr. Casey, I'll kind of turn to you for another component of the governance. And, I think as Ben was describing the importance of having representatives from all the different disciplines within an organization involved, from the clinical side, what does what does that look like? Because having worked with both systems and vendors in different capacities, each specialty can be its own discipline within a health system that is trying to advance potentially different priorities. So how do you help drive alignment on among the clinical team to be able to then work with what are probably also an equal number of varied interests when you're talking about the non-clinical side of the operation?
Yeah, it's a great question, Matt. And I would say it dovetails nicely on what Sonia and Ben were talking about as well, and that we were very intentional in that governance structure to include not just our clinical leaders, but actually our patients, which we can touch on as well, as critical voices within it. I think really that is once we define the larger kind of portfolios or buckets of work that we were looking to roll out. Very early on in the process, we engaged our clinical leaders and said, well, what does this mean for you in cardiology? What does this mean for you in dermatology, urology, whatever specialty we're looking at? And that's really where, from our providers and teams, a lot of the great ideas, bubbled up to the top to say, well, if we're doing, virtual specialty care, we should also consider adding this, or we should consider marketing this a little bit differently. So that has been a bit of an evolution. I think, like all things, you have your early adopters that have really taken this and run and been successful. And that's attracted, others that say, well, boy, now I see how this actually attracts new patients, provides better care, enhances the quality, whatever it may be. And the momentum really picks up from there.
So Dr. Casey, you brought it up. So you said you have patient involvement. I would love to hear more about what does that actually mean, and had you identify or maybe even select the patients who you got involved in that governance structure?
Yeah, absolutely. And this is a lot of credit to Ben, as well as our director for patient experience, Phil Shaw, on this one. But we really were trying to, from the start, solve for how do we ensure that the solutions we dream up, we're all consumers of healthcare to some degree as well, but we really want to hear from the folks that every day are interacting with our health system, because they're experiencing the pain points as well, that we're hoping to solve. So we were actually able to identify through the survey system that we use for all patient experience, we were able to reach out and say who'd be interested in providing feedback to the various solutions that we're putting into place. So it really has become kind of a sounding board for us as we think about, okay, here's a solution potentially that could work that our teams come up with. It allows us to reach out to patients and say, how would you prioritize these items? Or what are the things we're not thinking about that maybe we should include in this offering? So it's been a rich data set, and Ben, keep me honest, but I think we're up to over a few thousand patients that have kind of volunteered to be part of this as well.
Yeah, the response has been tremendous, and we were really excited and pleasantly surprised. It's several thousand patients that said, yep, I want to participate. I want to help, craft the future of Rush and my experience there. And so, yeah, it's been a tremendous early success. We're pulling these patient focus groups into the process with us as we design things like our new mobile app that'll be launching next year, as we start to add more same-day digital services that you can access kind of at your fingertips. And so, yeah, we're really thrilled about it. We're bullish on, really pulling our patients into the design process with us, and think that it's going to result in a lot better of experience for everybody as a result.
So as you've interacted and received kind of that feedback from patients, have there any surprises come up? Like, did you expect that you'd get a positive or negative response about a particular idea where you got the opposite kind of feedback from patients?
Yeah, it's a good question. I'm sure there have been some things that, we expected to go one way that maybe went another. I think more than anything, in a lot of ways, it's been reassuring to validate that the problems we thought we should be focusing on are the same problems that our patients want us to focus on. And so in many ways, it's not a story of surprises. It's a story of, yep, go solve the problems that, go solve access. If I can't get in to see a provider when I need to, nothing else matters, right? And that's a frequent refrain is how do I get in to see a clinician when I need them? And that can be today at 3:00. It could be tonight at 3 a.m., right? How do you create that always on sort of access model? So access has been a common refrain. I think the other part that's really hit home with us has been there's a lot of feedback around, hey, I need help navigating my healthcare journey. I can make it to an appointment, fine, but all of a sudden I've got 3 referrals that I need to schedule after that visit. And geez, I've got to call 3 different 800 numbers, or geez, I've got to work through a nurse on this and call the access center for that. So how do you help me do that in a more cohesive way? And we're really taking that to heart. I think we're going to be making some big bets in the year ahead about really focusing on that sort of patient navigation feature. How do we help patients get to where they need to be? How do we help them stay healthy in ways that are convenient for them? And a lot of this has been informed by these consumer feedback mechanisms that we're talking about.
Yeah, no, I think that, as you said, that seems to be a very impactful source of information. So as you're going to talking with the patients and then also just vetting more broadly, how do you kind of cut through the hype that might be generated or might drive misconceptions around what technology and digital can do for a healthcare organization?
Yeah, and there is a lot of hype. There's a lot of hype. There's a lot of buzzwords out there, right? That AI is on everybody's lips these days. I think, how we cut through it is to really focus on what's the problem we're trying to solve, right? If the problem is access, then there's a host of technologies that can help us make scheduling a little bit easier to help help connect the patient with the provider via messaging and that sort of thing. But as long as we're focusing on that problem, the technology is not the important part. It's how do you bring the care model around the problem? How do you get the operations figured out so that there's a clinician waiting for you when you send the message, or there's somebody who's ready to take that same day specialty visit that Dr. Casey alluded to. So there is a lot of buzz, there is a lot of hype in the marketplace, but I think for us, those are all just tools, right? We focus on what's the problem we're trying to solve for our patients, and then methodically through this sort of agile process that I alluded to before, then pick your tools, right? And that helps cut through a lot of the buzz in the marketplace because you know what you're looking for.
Yeah, no, I think those are all great points. And believe it or not, we're already almost out of time. So I want to thank my guests, Dr. Paul Casey, Ben Wolfe, and Sonia Singh for a great conversation today.
Thank you.
Thanks, Matt. Appreciate it.
And thank you to everyone listening. Keep the dialogue going and connect with me at #HCDEJURE. I'm Matt Fisher. Until next time.